Many patients suffering from type 2 diabetes rely on the popular drug Avandia to help lower their blood sugar levels. But recent studies show using Avandia has caused thousands of patients to have heart attacks and strokes. Next week, an FDA advisory panel will decide whether Avandia should stay on the market. Dr. Karen Boyle joins us to discuss the risks and benefits. Hi there, Dr. Boyle. Great to see you.
Great to see you, Tanya.
So, Dr. Boyle, first of all, what are all the risks and side effects currently associated with Avandia?
Well, Avandia is a drug that's been under a tremendous amount of scrutiny since 2007 when the FDA issued a black label warning patients about the side effects of heart attack, stroke, heart disease, worsening high blood pressure, and even death. So very serious medical complications from this drug.
And are these complications more serious than those of other similar drugs?
They are. This drug has been compared to its competitor, and what they found was that 500 more patients were likely to have heart attack and 300 more patients were likely to have stroke. So this is a drug that has significant, possibly life-threatening side effects to it and much greater risk than its competitors.
And so do you, as a doctor, when you look at this information, do you believe that in this case the risks outweigh the benefits of this drug?
Well, here's the thing. We treat diabetes so that patients don't have some of these complications, and a lot of patients with diabetes are already at increased risk. So why would you give a drug that would increase the things that you're trying to prevent, namely heart attack, heart disease, stroke, and even death?
Right.
It just doesn't make sense.
So the FDA is going to look at all this information, and if the FDA decides to pull Avandia off the shelves, what's going to happen to all those patients who rely on this drug right now to stabilize their blood sugar levels?
Well, the good thing is that a lot of doctors that treat diabetes are already really aware of these risks and what may happen with the FDA. So a lot of doctors have already transitioned their patients off of Avandia. For patients that are still on Avandia, the first thing is they should not panic and they should contact their doctor if Avandia is pulled off the market and not just stop it, because the last thing we want to do is have lots of patients have irregularities in their blood sugar. And then their doctor will work with them to transition them to an alternative medication to treat their diabetes.
So before we talk about those alternatives, how popular has Avandia been? I mean, it sounds to me like you're saying that doctors have already been kind of slowly pulling their patients off of this drug. Does it continue to be popular?
Well, there are still a lot of patients on Avandia, although since the 2007 warning came out, it decreased. And then again in the winter when some of these studies came out, especially recently studies in JAMA came out, it's been slowly decreasing popularity. But there still are probably thousands, if not millions of patients on Avandia, but it has decreased significantly in popularity.
And so what are the alternatives to taking Avandia for those who need to switch or want to switch at this point to a different medication?
Well, the first thing is to contact your doctor and not just try to stop the medicine and try something else. But its competitor, the same class of medication as Avandia, is a medicine named Actos, which works in similar mechanism. And then there are other medicines that people with diabetes may be already familiar with or had been on previous to Avandia, things like metformin, glyburide, glipizide. So there's a whole host of medicines that physicians can take from and try with their patients that they're going to transition off of Avandia.
And now, do these other medications, these other drugs, do they have different side effects that could be just as hazardous?
Well, they did a study comparing Avandia to Actos, and Actos seemed to be much safer than Avandia. And they actually even did a study looking at half the dose of Avandia when combined with metformin, and the risks did decrease. But none of these other medications have the significant life-threatening side effects to the same level as Avandia has had.
So the future doesn't look too bright for Avandia after hearing all of this. Do you think, Dr. Boyle, that the FDA will probably rule to take it off the market?
I think that the FDA probably will err on the side of caution with this medication. I mean, it's been wrought with a lot of controversy since it came out, and then again in 2007, and again in the winter, and then again with the new research that just came out of JAMA. There are a lot of lawsuits surrounding Avandia, and so, the FDA is usually pretty conservative, and they want to treat diabetes and treat it effectively, but, the key is not to cause harm. So
right.
I think that they'll be conservative, and I won't be surprised if they end up making recommendations against Avandia.
And again, Avandia was a drug that was targeting type 2 diabetics, is that right? Remind us again the difference between type 1 and type 2.
So type 1 diabetes is often the diabetes that you think about associated with childhood. It's something that usually is diagnosed early in life, whereas type 2 diabetes is usually diagnosed as people get older and often related to weight gain. And again, diabetes is when blood sugar levels are out of control, which can be a very serious medical problem.
And a growing one in this country, is that right, Dr. Boyle?
You know, unfortunately, with weight and obesity becoming such an increased issue, often we perceive as sort of an epidemic in this population, diabetes, especially type 2 diabetes, has become much more prevalent in this country. So that's why, the medications like Avandia, Actos, and other medications, and the development of future drugs is so important because diabetes, especially type 2, has become so common.
Absolutely. All right. Thank you so much, Dr. Boyle, for all that very important information. And if you are a type 2 diabetes patient taking Avandia, talk to your doctor to see if the medication is still right for you. And you can, of course, always visit the health page at abcnews.com for the latest health news.